This video is made possible by our loyal Patreon supporters. Visit patreon.com/PsycheTruth.
Hello, welcome. Today I'm going to be doing a massage to help relieve frozen shoulder. I will be working on a lovely Lauren. Let's go ahead and get started. If you don't have time to watch this video right now, go ahead and save to your watch later and just watch whenever you get a chance. So whenever someone has a frozen shoulder, there's a lot of different components to it. And with somebody face down like this, the first spot that I would want to work on is the upper traps. And you can do some great warm up here without thinking too much about it. If you're a novice and you're just kind of wanting to learn a little bit more about massage, just kind of think you want to press around the shoulder blade, around the scapula. And you have a lot of sensitivity in your finger pads, especially your thumbs. So you can just kind of start to see what's going on with this muscle. And first you have to kind of distinguish between muscle tone and just a really angry muscle. Kind of see what you're working with. Usually with a frozen shoulder, the upper trap is going to be just over functioning and really contracted. And you don't have to get fancy or use any super fancy techniques to do a nice warm up on the upper trap. There's a few different muscles that I'm going to focus on to help with relieving the frozen shoulder. So first it's the upper trap, and the rest of the muscles should start to relax a little bit if the upper trap cooperates. And just because for filming purposes, I'm just going to be doing this trap work on this side, and I'm going to be doing the rest of the demonstration on this opposite side so that you can kind of see a little better. So I'm going to go ahead and grab my oil, just kind of a short warm up today. And keep in mind that if somebody has a frozen shoulder, their nervous system is probably like pretty out of sorts. So you might feel tempted to just start with deeper work kind of right away, but you really can't do that with frozen shoulder. You have to help calm everything down too. So you want to just start with some nice soothing effleurage strokes or whatever technique you want to use. Even some lighter compressive circles or whatever. And just offering a soothing touch to start. That doesn't mean that you can't offer some pressure, but you want to definitely work on that soft tissue and communicate to the nerves that control the muscle that everything is going to be okay. It's really good when you're working on that upper trap if you can bring your work into the muscle as it narrows into the neck. Sometimes that tension can just creep up all the way into the neck, and people kind of walk around with their shoulder, especially the frozen shoulder, lifted, and just their neck is sore and everything feels kind of out of whack. And just let your hands be really fluid. You don't want rigid fingers because it's gonna feel hard to have a nice flow. And really no hurries here. I'm just tracing that shoulder blade, that bone, and clearing out a little bit of this congestion. at this point, I can kind of think about going in with my forearm and my elbow. And I am just saying hello to the infraspinatus. That is a rotator cuff muscle that definitely influences a shoulder that's locked up. So this is just a nice way to communicate with those nerve endings and help calm everything down. And also just to give Lauren a heads up that I will be kind of working there too. And you always want to work on the deltoids as well. So just kind of doing a proper warm up. So I really want to get a nice catch of the muscle today, so I don't want a lot of oil. I'm just gonna grab the oil that I need with my forearms. I don't need to grab any more. And don't worry if it's not perfectly flowy, this part, just kind of getting the oil. You really don't need much. And I like to just trace the vertebrae, work on these rhomboid muscles a little bit. Not really all that concerned with working on the rhomboids a whole lot. With someone that has frozen shoulder, I'd rather work on getting to the deeper layers of tissue in the upper traps and the infraspinatus would be kind of the main things I want to spend my time on. Just always finding kind of graceful ways to transition between each technique. Trying out new techniques. So I have a pretty good sense of just the level of contraction in that upper trap at this point. And because I've been doing massage a pretty long time, you develop sensitivity in your forearm and your elbow. Kind of have eyes there the more that you practice using it. But at first it can feel like you can't really feel the muscle that well. Just keep practicing. So I am just gradually starting to increase the pressure that I'm using, and I'm still using a really broad surface area, pretty much my whole forearm. So it's going to feel really tolerable. And I'm going to gradually start to do some trigger point here. So I'm going to land on these little pockets of tissue that are super contracted and then release. You do want to get as close to the shoulder blade as you can, even underneath it, when you're dealing with someone that has frozen shoulder. Sometimes I'll angle my elbow and it will lift the shoulder blade a little bit. You can move the arm around to lift the shoulder blade as well, but often I just want to let my client be and kind of do everything I can without having them move around a lot. Especially when I start to go deeper, it's like a meditation almost, of just like relaxing with the increased pressure. Can feel pretty uncomfortable. Usually people with frozen shoulder are willing to do anything and, bear any depth of pressure to get help. Some people with frozen shoulder, when you're doing this work, they will respond pretty well, but keep in mind that this muscle, this upper trap, is usually so locked up that it usually takes a few sessions to make the kind of progress that you need. At least a couple. So as you're working on these different areas, just budget your time well, because you don't need to get it all worked out in one session or have that expectation of yourself. So moving on, so we are ready to work on the infraspinatus, and I'm going to demonstrate on this opposite shoulder. For this work in the infraspinatus, I'm going to change position of the arm just to open up that muscle a little bit more. It's going to make it a lot easier for me. So again, I'm just going to kind of start slowly, and I am making this muscle a little bit more taut. I'm just going to drag my right arm down as I use the heel of my hand to work on these more superficial layers of tissue in here. Lauren's not going to feel a whole lot at this point, but part of this is like retraining the nervous system to like just calm down. With a lighter touch like that, it's really helpful for the nervous system. And that work in the upper trap, we're pretending that we're working on the same arm, should have helped this infraspinatus calm down a little. I don't typically start with this muscle because the upper trap is usually, it's pretty much always the leader when it comes to frozen shoulder issues. It might not feel that way as someone who has frozen shoulder. So you can't really see it, but I am starting to increase my pressure. This is a really thick muscle, and you do need to use a good bit of pressure to really get in there. You're most likely going to feel like you're going to slip off, which you kind of want to have that feeling without slipping off of the muscle. Just go slow. Don't use too much oil. Focusing on this muscle belly. And you can even use a little distraction technique. You can just shake a little bit if you have a secure hold on that muscle. And depending on how much time you have, you can also work on the teres minor and major. Always a good idea, even if it's just for a little bit. I'm just really encouraging these rotator cuff muscles to relax. And lastly, I am going to, I don't really have the oil that I need. I'm going to grab a little bit more oil. With frozen shoulder, you do want to work on that deltoid and that bicep, even that bicep tendon if you have time. I'm not going to spend a whole lot of time, but after working on that infraspinatus, it's really good to at least do some soothing strokes around that deltoid. The deltoid is usually pretty locked up because of what's going on with that infraspinatus. It's good to just help that all calm down. And if I were doing video number 2, like as a follow-up, I would do a lot more detailed work in this deltoid, and I would also work on the bicep tendon quite a bit. And always to finish, I like to just do a more soothing effleurage stroke, and something for both sides just to tie it all together, and also just make nice with those areas that I went a little bit deeper in. And that is all for today. Thank you for joining me today. I hope that you enjoyed today's video, and I look forward to seeing you next time.